Welcome back to Sunday Live, and I'm joined tonight by Peter Munya. Governor Munya heads the Council of Governors, and we're discussing devolution, but principally healthcare, which currently seems to be a crisis. Now, today you asked the Cabinet Secretary for Healthcare, James Macharia, to desist from commenting on matters of health, and you said they have no supervisory role. Let me ask this, do you believe they have any oversight role, and are you not supposed to be working together in partnership to ensure that you do deliver decent, quality healthcare to Kenyans?
Julie, before I answer that, I want to congratulate the Kenyan sportsmen and women who have made this country great. I think this is a time we are celebrating, and if I'm here, I don't say that that will not be good.
They've done
there are great
job.
things that happen in this country, and that's one of the things that is happening.
Let's get to health.
But going back to health, we have two levels of government under the new constitution. The two levels of government are sovereign. In fact, if you read the constitution, it says sovereignty is exercised at two levels, at the national level and the county level. And these governments only work together. They're interdependent and they work in cooperation. There is no level of government that is supposed to talk at the other level of government. So if there are issues, we are supposed to sit down, discuss them, resolve them. So issuing ultimatums to county governments and assuming powers you don't have is what will take back the country where we are.
Governor,
we are moved on now.
Governor Munya, as it stands right now, we have devolved healthcare. The healthcare is in your hands. As governors, we need to ensure that you are delivering quality to the people. And we have SMSs coming in from different areas. I'll read some of them in just a short while. But your relationship must be maintained also with the ministry. It looks like there's a lot of posturing going on. How do we resolve the issues at the grassroots level if there's so much leadership posturing ongoing?
The posturing, Julie, will end when the ministry, the national government department, ended my Macharia will sit down and talk with the county governments. Remember the medical equipment issue. We asked them to sit down with us, resolve it, talk to us. We talked and talked, it never happened. And we said as counties, we want to move on over that matter. We moved on. Now all we hear is Macharia talking, saying this and the other. Meetings, we have called many meetings for us to sit down and see how we cooperate.
Are you saying you cannot meet with the Cabinet Secretary?
We call him, he doesn't come. We have called him many times. I have personally talked to him several times for meetings. We've not met him officially. So the posturing, if there is.
You're saying it's on his end.
Ask the national government why they are posturing on this matter.
Let's go to human resource issues and the serious issues that are raised by doctors and healthcare workers in general. Issues of pay, one of them.
Yes.
Issues of promotions, another.
Yes.
We have serious issues being raised about people feeling uncomfortable and threatened in certain counties. And this comes back to ethnicity. Issues around
Julie,
the push and pull.
I'll start with the issues of pay.
Yes.
Issues of pay, two issues. One is delay of payment of salaries. Delay of payment of salaries at the end of the financial year, because you can see most of these problems come at the end of the financial year, when the national government delays in releasing money to pay workers. Not just the elder workers. It's only that the elder workers are the ones who come out. Delays in payments. If the national government delays in releasing money to counties, obviously, salaries delay.
You're saying this is a treasury issue?
Treasury issue. Last year, remember last year, there were delays. At least they released money. They gave us some advance payments. Some money that they gave us, we paid salary. This year, they refused to do it. That's why the crisis went on.
Let's stay with
now,
Treasury,
yes.
Before we move on for a moment, because in July we had information out questioning procurement, questioning, expensive foreign trips and other, services and products that, it felt that there were questions over whether county governments needed these things. Now, you're running county governments on the back of budgets that by virtue of experience.
Are you saying trips, if people are going out and all that, makes the treasury delay releasing?
No, let me make my point.
Because the point we're discussing is the release of money.
But allow me to make my point. Allow me to make my point. The concern comes with the citizenry when people sit back and say, look, there are questions over use of funds. That's what I'm talking about. There are questions over corruption. And so even the way the county governments operate and use their funds has been questioned. Treasury has raised issues as well. Now, my question would be, with an issue like healthcare, we've seen people dying in hospitals over the past few weeks over strikes. Would a county government not then say, healthcare is a priority issue, we are setting aside budgets for payments for the year in case we find that, as happened last year, there are delays? Julie, is this not management and is this not leadership?
I think you've not understood it. The problem of delay of releasing money from the national government has nothing to do with whether you have set aside the money or not. The money is already set aside, it is in the budget.
This is
at the end of the year, we are not allowed to keep any money at the account. By law.
This is
by law, listen, by law, we are not allowed to keep money. Once the year ends, we are supposed to bring all the money back to the central bank.
So you're saying you cannot allocate?
Yes, we are not allowed by law.
Anything
we allocate already, we have already done. We can't. By law, we can't. That's the problem.
Let's go to the next.
We are not allowed to. I hope you have understood that.
The next
even when we have money, like for example, I give you Meru situation. At the end of the financial year, national government are not released 3 tranches of money. So we had a lot of money that we could have used to pay salary. Salary is not so much money anyway because it's 1 month's salary.
But you could.
But that money,
what you're saying?
That money, whatever money is left down there, even the money you have collected, you are supposed to sweep over of it back. Then you finalize the budget, the money is brought back. Now that's where the problem is. Let's go. Now that problem can be addressed if we were allowed to keep money to pay, and that means we need to amend the law. The other thing is government releasing some of the money to be able to pay salaries for that period before issues of budget and all that are sorted out.
The question that
if you blame the counties on that, I don't know what solution you would want us to give.
The question that I have is, when a grandmother is sitting at the hospital, these stories for her mean nothing. Leadership is finding solutions to challenges. But let's move on and go to the other human resource issues.
And there were issues you said also about corruption and all that. I mean, corruption is an issue. Both levels of government are dealing with.
Absolutely.
Yeah, it is there, and nobody, no Kenyan will say there is no corruption, there is no mismanagement. It is there. We are grappling with it. We are trying to see loopholes everywhere to make sure that money properly is managed. So the issue of releasing money to pay salaries is not an issue of corruption. It's an issue of national government releasing money. Can they release money in time so that we carry out our mandate? And this money does not belong to the national government. That money is collected by an agency empowered by law at the national level to collect on behalf of both levels of government.
All this is understood, Bwana Munya. The question is, how do we have efficiency in the system? Rather than saying there are loopholes at every level. Yes, we have corruption, and I cannot deal with this loophole on
what
payment.
We need to do,
we need leadership.
Yes, we need leadership at both levels, because both levels of government must work together to resolve the matter. Now, if we are in a situation where we call for meetings, we ask for meetings from the ministry, national ministry, to meet and agree on how to resolve these issues. Those meetings are not forthcoming. What are we supposed to do to give leadership beyond that? You know, what we have done, and I can give you examples.
I want to stop you for a moment. You give me examples for a moment. I want to stop you for a moment and pose the question: if we sat in a room with governors and asked the question, what hospitals do each of you use? What will we find? Somebody here has tweeted in and said, governors should not speak, they never attend, neither seek service from public hospitals. And perhaps this is part of the challenge that we have, that we seem to have 2 different levels. And if you are not actually using those services, you don't appreciate the challenges that you're
Julie, you know, the problem with people speaking in Nairobi is that...
in Nairobi?
Yes. I'm sorry to say so.
Yes.
Because unfortunately a lot of people who live in Nairobi don't even travel up country to know what is happening.
So you visit?
We have done a lot of work in improving our hospitals. I can give you example.
Go ahead. Yes.
Meru Level 5 Hospital, which we have improved. We have put modern machines there. The traffic has increased. We have added more doctors. We have increased the nurses there. We have streamlined management there. And go and look at the traffic that is going there now. And I can give you examples. I'm just giving you Meru because I come from there. I can give you many examples. So health care has improved over the years. I can give you statistics. We have added nurses, we have increased the nurses by 243%. Doctors have increased in the counties by 34%. We have increased even let me give you viewers. Let me give you viewers.
So
really, I just wanted to explain that.
Yes, that we make some gains.
Challenges in terms of management of human resource should not be interpreted to mean that there is
overall failure
in the health sector.
Understood. Let me read.
So there are challenges which we need to sit down and see how we address, and the personnel challenges, because it involves resources.
Yes.
And resources are being collected centrally, require both levels of government to sit down and see how to make sure that at the end of the financial year, resources are available in time to pay salaries.
And we hope that the message is certainly getting home, and that is critical. Treasury, we hope you're listening. I'm going to read a couple more SMSs, tweets that have come in. Patrick Brown says, to devolve medical services was a mistake. Why should we allow people to die at the hands of a few individuals? Somebody else sharing their views and says, the experience so far of devolving health is not positive. Lobby for enough funds or centralized. Now, you know, we're discussing the funding, we're discussing the delays. As we come to the end of this interview, two things are clear.
Yes.
The access to funds is critical.
Yes.
Number two, the relationship that the county governors have with the cabinet secretary is critical. How do we resolve, as the leader of the Council of Governors right now, how do we resolve those two issues?
Those are good questions, Julie.
How do we resolve these two issues?
Number one, 3 issues. I've already explained the first issue. How do we get money in time? The current allocation, how do we get it in time at the end of the financial year to pay salaries and provide services? That's an issue that requires a sitting. We have also been asking for a meeting for a summit, because the summit is the highest decision-making body in the country for both levels of government. It has not been forthcoming. A year has ended. We keep asking, we are told we'll give you a date. It has not been coming. We have been asking the minister to meet us. I am now appealing for a meeting between the Council of Governors and the minister, and also for the summit to look at these issues. These are serious issues. They involve lives of people. Right
here on Sunday Live, the Council of Governors requesting a meeting with the Cabinet Secretary Health, James Macharia, and the summit, saying this is key. Your final word.
Secondly, Julie, the Ministry of Health is allocated last financial year 44 billion. The entire devolved health sector is given 16 billion. That tells you where the money is. If you are keeping at the national level 44 billion to run 2 referral hospitals, Kenyatta National Hospital and Moi Referral Hospital, that are in very bad shape to this day.
What are you doing to get more funds?
They are in very bad shape.
What are you doing to get more funds?
We have been asking for more money for this. Most of this money to be devolved. It's not forthcoming. That's why we are also prepared to go to court, because that's the only option we have, to go to court to demand more money from the national government. It doesn't make sense for the national government to keep 44 billion at the national level when the health sector is devolved. Give us a paltry 16 billion to distribute in all the 47 counties, and then keep asking and talking at us when you are keeping all the money. That's why they have now enough money to walk around, to do whatever they want to do.
Finally, you know. Are you proud? Are you happy of the way that county governments has dealt with healthcare?
Julie,
can you honestly say?
Julie,
when you
yes, I can. Looking at you in the face, that the county government have made tremendous progress in restoring the health sector, in improving it, in employing more staff, in increasing facilities, opening new ones, in employing more personnel. But we still have challenges.
Yes.
We have many challenges. We are only 3 years old. Devolved government in this country is at its nascent stage. It is very young. What we require is nurturing, looking at issues, resolving them. We don't require people giving others ultimatums, trying to look for excuses to bring back the country where it was. Kenya has moved, and we need those people who are still stuck with the old Kenya to get moving with the rest of the country. And that's where we are, and that's the problem we are experiencing
today. Thank you for joining us on Sunday Live. So, huge issues still being dealt with in the healthcare sector, but Governor Munya says they have made progress. The big problem, it seems, is a lot of posturing between different players, and how do we get them together to understand that at the end of the day, it's the life of the Kenyan who needs services from these hospitals that matters, not the power games. Share your views with us, 22422, also on Twitter at Citizen TV Kenya, at Julie Gishuru, hashtag Sunday Live, and we'll share your views with the Council of Governors as they come in, and with the ministry as well. Are you happy with healthcare in your area? What do you think? My director is saying no. She'll share her views